how insulin resistance affects mental health, and the critical role of vitamin B12. Dear friends, there is something quietly changing in our homes, in our families, in our society, and most of the time, we don't recognize it until it becomes serious. More and more people today are saying, "I feel tired all the time. I can't focus. My memory is not what it used to be. I feel anxious without reason. I don't enjoy life anymore." And very often, the answer they receive is, "You are depressed. You have anxiety. You need medication." Now, yes, sometimes that is true. But let us pause for a moment. What if something deeper is happening? What if the brain is not just emotionally disturbed, but biologically struggling? What if the brain is not getting proper energy, not getting proper nutrition, and slowly losing its balance? A story close to home. Let me share a story, one that may feel familiar. This is about a woman I will call Mira. Mira was 58 years old, a school teacher. She lived a simple life, like many families in India. Morning tea, often with biscuits. Breakfast, sometimes skipped, sometimes paratha. Lunch, rice with curry. Evening tea again, maybe some snacks. Dinner, rice or roti. No smoking, no alcohol. A normal life. She was known for her sharp mind. She could remember every student's name, every lesson, every detail. But slowly, things began to change. At first, it was small. She would forget where she kept things. She would pause in the middle of a sentence. She would repeat questions. Then came the fatigue. Not normal tiredness, but a deep exhaustion. She would say, "I sleep, but I don't feel rested." Then her mood changed. She became quiet, withdrawn, irritable. Her daughter said, "Ma doesn't laugh anymore." The family became worried. They thought, is this depression? Is this aging? Is this early dementia? She was taken to doctors. She was given antidepressants, sleeping pills, advice like reduce stress, stay positive. Months passed, but she did not improve. In fact, she felt worse, slower, heavier, disconnected. One day, she said something that shook her family. She said, "I feel like my brain is shutting down, like I am disappearing." A different approach. When she came for further evaluation, something different was done. Instead of only focusing on her thoughts, we looked at her metabolism. Her reports showed slightly elevated fasting sugar, high insulin levels, clear insulin resistance. She was not diabetic yet, but her body was already struggling. And then, another finding. Her vitamin B12 levels were low. No one had connected these to her mental symptoms. What changed everything? Instead of adding more psychiatric drugs, we changed the direction. Her diet was modified. Less refined carbohydrates, less sugar spikes. She was encouraged to move daily, even simple walking. Her vitamin B12 deficiency was corrected. And slowly, something beautiful happened. Her energy improved. Her sleep became deeper. Her thinking became clearer. She started smiling again. One day, she said, "I feel like someone switched the lights back on in my brain." So what was happening? Was she mentally ill? Or was her brain underfueled, inflamed, nutritionally deficient? This is the question we must begin to ask. Understanding insulin resistance. Let us understand this in the simplest way. When we eat food, especially carbohydrates like rice, roti, sugar, sweets, packaged snacks, our body produces insulin. Insulin helps glucose enter cells to produce energy. But in insulin resistance, insulin is present, glucose is present, but cells do not respond properly. So glucose stays in the blood, and the body produces more insulin. This becomes a cycle. Why this is important in the Indian context in India, especially in many regions. Diets are high in refined carbohydrates. White rice is a staple. Frequent tea with sugar is common. Physical activity has reduced. Even people who are not overweight can have insulin resistance. This is sometimes called thin outside, fat inside. So a person may look normal, but metabolically, they are struggling. Now, the key point. Insulin resistance does not just affect the body, it affects the brain. Mechanism 1. Brain energy deficiency. The brain needs constant energy. When insulin resistance develops, glucose is not efficiently used. The brain experiences a fuel shortage. Simple analogy. Imagine electricity supply becomes unstable. Lights flicker, fans slow down. That is what happens in the brain. Symptoms: brain fog, low energy, poor focus, depression. Mechanism 2. Chronic inflammation. Insulin resistance creates ongoing inflammation, not visible, but real. This inflammation affects brain cells. It disrupts normal function and contributes to depression, fatigue, emotional dullness. Mechanism 3. Neurotransmitter imbalance. We often hear depression is due to low serotonin, but what controls serotonin? Metabolism. Insulin helps regulate brain chemicals. When insulin resistance occurs, dopamine drops, low motivation, serotonin imbalance, mood changes. So the issue is not just chemicals, but the system controlling them. Mechanism 4. Stress hormone imbalance. Insulin resistance increases cortisol. High cortisol leads to anxiety, poor sleep, irritability, and this worsens insulin resistance. A vicious cycle. Mechanism 5. Reduced brain blood flow. Blood vessels become less efficient. The brain receives less oxygen, less nutrients. This leads to slowed thinking, memory problems. Scientific evidence. People with type 2 diabetes have higher depression, higher anxiety, increased cognitive decline. And importantly, these changes begin before diabetes. Now let us talk about vitamin B12. Even if metabolism improves, some people still struggle. Why? Because the brain also needs nutrients. Vitamin B12 deficiency in India. This is very important. Many Indians follow vegetarian diets, low animal product intake. Vitamin B12 is mainly found in meat, fish, eggs. Dairy-strict vegetarians, especially older adults, are at high risk of deficiency. Role of vitamin B12. Vitamin B12 is essential for nerve protection, myelin, brain signaling, memory, mood regulation. Symptoms of B12 deficiency: fatigue, depression, memory loss, irritability, tingling in hands, feet, in severe cases, confusion, cognitive decline, behavioral changes, critical clinical connection. Patients with type 2 diabetes often take metformin. Long-term use can reduce vitamin B12 levels. So now we have insulin resistance affecting brain energy, B12 deficiency affecting nerve function. Together, they create a powerful impact on mental health. A new understanding. Mental health is not just psychological, it is also metabolic, nutritional, what families can do. This is where real change begins, at home. 1. Food awareness. Reduce excess sugar, limit refined carbohydrates, avoid frequent snacking. 2. Balanced diet. Include protein, include healthy fats, ensure micronutrients. 3. B12 awareness. Check levels if vegetarian, consider supplementation if needed. 4. Movement. Daily walking, simple physical activity. 5. Do not ignore symptoms. Fatigue is not always normal. Brain fog is not always aging. What needs to change in healthcare? We need integration. Mental health care must include metabolic evaluation, nutritional assessment. Many clinicians are not trained this way, but this is changing. Scientific references. Kuhlman et al. Brain insulin resistance. Kraft et al. Insulin and Alzheimer's. Lustman et al. Depression and diabetes. Reynolds et al. B12 and nervous system. De Jager et al. Metformin and B12 deficiency. Final reflection. Let us return to Mira. She was not losing her mind. Her brain was underfueled, inflamed, undernourished, and when those were corrected, she came back. Final message. Mental health is not just about the mind. It is about how we fuel the brain and how we nourish it. If we understand this, we can reduce suffering in our homes, in our communities, in our healthcare system, and perhaps help someone before they feel like they are disappearing. Thank you. Founder, Holistic Wellness Foundation. IMFEL, Healing Beyond Boundaries.